And now moving on to Ferranti Wong. As an expert clinician in paediatric dentistry, what do you see as the biggest problem facing children's oral health, and what impact does this have on both children and society?
Well, as you say, that as clinicians, we have a different view with the public of things happening. The biggest impact, I would say that, as you can see, I'm going to show some horrible pictures as Richard is going to go through them. Let's have a first slide. Okay, the first slide you can see is a horrible pictures, of a child, which I personally see quite a lot over 30 years working in pediatric dentistry. We're still seeing exactly the same thing over and over and over again. Now, I know that Sir Paul has quite rightly said that the oral health of children is improved, but then Emma said that under 5 is still continue to increase, and over the 30 years of child dental survey, the under 5 has not changed very much, and this is the kind of thing that we see. Next slide, please, Richard. I think people have quoted that 25% of the under 5 still have dental decay. Next slide, please. And then we know that the dental decay does not only affect the child, but then they also, not only on the pain and things like that, they affect their learning ability. Look at the schooling they miss. Look at that, the amount of time that the parents have to take off work, and the societal cost for dealing with what we have been said many, many times, a preventable disease that society pay for it, the child suffer for it, the education they're going to be suffer as well. I think it's quite a big impact on that. Number 4, please. And also, as we said, that the under 5, as what Royal College of London, England said that about the increase, not only they have tooth extraction, a number of them who come to our hospital is that to have extraction under general anesthetic. It's not only one tooth, but more than one tooth, they're going to have them extracted as well. So even though with so-called improvement dental health, it's not improved enough, and still a large amount of the preschool children are being affected by this dental caries and dental decay that we are coming in contact with.
Yeah. You've highlighted there some of the issues facing children's oral health, but what is the solution and how do we overcome these?
Well, as next slide, please. As we know that it's always prevention, prevention, and preventions. And people talk about prevention can be divided into 3 parts: primary, secondary, and tertiary. And it can apply to different people in different ways. I rather like to use the 3R, which I just think of. It's to resist the decay first, or to protect it, to repair once we have that, whether it's initial, whether it's later on, or at the end, something we do not want to remove them. Of course, the prevention is based on the first 2, either primary or secondary, or to resist or repair. Next slide, please. Of course, that the best practice and the 2 kits that we're talking about is that there is obviously the one that talking about dietary advice, and then the brush teeth twice daily, and then going to see the dentist. And Sarah Hurry, I think, continue to push on because caries are multifactorial. But we know that the changing people's dietary behavior is a big cultural change, a big cultural behavioral change. Going to dentist, at least at this moment, is about drilling and filling. It's not something that which we would like to do. But looking at the whole of the concept, even you can see the bottom line, is that to brush the teeth, if you can click that now, Richard, and is the main thing that we are talking about is brush the teeth as frequently, at least twice daily, with a fluoride toothpaste. The only thing about that, fluoride toothpaste has been with us since the 1960s. But is it the only thing that we can use? I have got much doubt and also limitations about that as well.
Yeah. So you mentioned there are limitations with the current recommendations regarding the toothpaste and what's included within, I guess, our guidelines for prevention from Public Health England. And you say the standards of toothpaste aren't necessarily 100% effective. So what improvements in toothpaste would you like to see that would bring added benefits in the prevention of decay in children's teeth?
Just not misunderstanding. I did not say fluoride is bad. Okay, fluoride is good. It's done a really, really good job for a long time. Next
Sure.
slide, please. But in a very, very sort of simplistic form, we know that enamel is made up of hydrous apatite, which is calcium phosphate compound on that. Most of the nowadays, the commercial toothpaste we're using is based on sodium fluoride and only give you the way of having the calcium and phosphate to form hydrous apatite using the ingredient within the saliva. But saliva distribution is changing from people to people and then from place to place. The distribution is not the same in everywhere within the mouth system as well. So I think that's why BioMin has been introduced, that it not only has got fluoride, it's got the calcium and phosphate ingredient within it, which can then provide the ingredient to resist, which is that to neutralize the acid attack. And also, if you can see the left-hand picture, the initial caries lesions, it can also remineralize. I think the interesting thing is that the calcium and phosphate and even fluoride are incorporated into a glass structure, which I hope that Robert Hill is going to talk about, and it's a slow releasing rather than having it, just come there and be washed away. And the other thing that which sometimes we do see in clinic as well, I know that a lot of people talk about fluoridation, although now I fully support it myself, but there are people who are against fluoride as well. So next slide, please. So the people who still think that might be a minority of a community still think that fluoride can be poisonous, by having the calcium and phosphate within the toothpaste might be just enough to tip the balance in order to resist and also to repair any caries lesion which has been produced by acidic attack.
Yeah. So, I mean, you've discussed the importance of remineralization properties here, and which are not commonly found, in standard toothpaste aside from decay. What